Hi, everyone, and welcome to this week's What's What webinar on low back care. My name is Drew Weiser. I'm program manager at the Dublin Fitness Center. Before we start, I'd just like to point out that this session is educational only and not intended to provide medical advice. We're going to start right away by testing your knowledge. How many adults do you think will experience low back pain at some point in their lives? 50, 70, 80, or 90? And it is 80% adults. I'm guessing that most of you here today are probably here because you've experienced some back pain before in your life. And it's very likely that most people you know will, as 80% of adults will experience it at some point during their lives. Low back pain is one of the biggest reasons for the missed work days and the leading cause of job-related disability. So now let's take a look at what some of the common causes of low back problems are. There's many different ones. First being sprains and strains, and these may come from cases such as poor lifting technique, or when you're lifting an object that's too heavy, you're twisting the wrong way while you're lifting it, or maybe you take the object that you're lifting and the load moves a little too far away from your body, causing a sprain or a strain. There's trauma, which could include sports injuries, accidents, or falls. You could have problems with your intervertebral discs. These are the discs that cushion the vertebrae in the spine. And so some things that you have probably heard of before are ruptures, bulging discs, or just in general degeneration over time. Many people deal with arthritis and the inflammation that happens around the joints within the spine, but there could also be other medical conditions such as scoliosis, fibromyalgia, and pregnancy. And other factors as well, such as compressed spinal nerve, skeletal issues, or infections. So you can see that there's lots of different causes, and that increases the risk for all of us. So let's talk next about the triggers for the low back issues that we see. Many times the back problems come on over time due to lifestyle factors or even a result of one bad movement. I'm sure we've all been there before with move the wrong way and you can feel something go wrong right away. So some different triggers for our low back issues are an inactive lifestyle. If you're active and your muscles are strengthened the right way, as well as lengthened the right way, meaning that they're flexible, then those muscles are going to be less prone to injury. So if you're inactive and you're staying in a single position for too long, that could end up leading to weak muscles and tight muscles, making you more prone to injury. As well, that goes along with that is poor posture from when we're sitting, we're standing, or we're driving. If you're overexerting yourself in work or play, if you're someone that has that weekend warrior mentality, and you're getting yourself really, really sore with the workouts and things that you're doing, then you're going to increase that risk of injury to the low back. Poor body mechanics. So if you're bending down to lift something, reaching for something, carrying things that are too heavy, you're increasing your risk. Tobacco use actually interferes with nourishing the body, slows healing, and if you're a heavy smoker, then you may have a heavy cough that can affect those muscles in the lower back as well. Poor sleeping position. So if you have a mattress that's giving you poor support, or maybe you're just in a position that's not ideal for your body, you can start to have low back issues. And then finally, stress has several effects on our body. It may increase muscular tension. And then, of course, behavioral health concerns such as depression and anxiety can influence pain and how severe it is perceived to be. So those are what we talk about with as far as the triggers go. Let's look at the things that we can do to care for our back and low back problems. So no surprise, we're going to start with exercise. And when we start our exercise routine, start with a low intensity and progress it slowly. So many people want to get in and just start going as hard as they can, but that opens up a window where we're going to be at a higher risk for injury. So progress things slowly when you start your exercise routine. You want to work in a lot of core strengthening exercises. The core muscles that we refer to are in the trunk of our body, and keeping them strong helps support the low back. Just one thing to note is that a lot of times when we talk about our core, people think of just their abs, the front side of our trunk. I want you to also think about the back side of your trunk too, and in that being, I'm talking about the glutes. So if we strengthen our abs and our glutes, we have a nice stable base around our trunk. So examples of exercises could be, for your core, you're going to do a plank hold, or for the front side of your core, you're going to do a plank hold. For the back side of your core, you're going to work a glutes with glute bridges. So think about that when you strengthen your core. Going along with the strengthening, we want to have good flexibility so that our muscles can move properly. So make stretching a regular part of your routine to reduce stiffness, increase your range of motion, and overall reduce any risk for injury. And then you just need to make it a normal part of your routine. Be physically active regularly, whether it is through structured exercise like we've talked about through these first 3 steps, or just getting up and moving. Keep moving, because that sedentary lifestyle and being in the same position increases the risk of back problems. Learn proper posture and body mechanics. So it could be a time for you to look in to see if Cardinal Health has any resources such as an injury prevention and treatment team, or someone to provide ergonomic assessments to make sure that you're moving and your workspace is set up properly. And always important, listen to your body. It's not worth it to push through pain. If you need to back down on what you're doing, then stop. Okay, your body will be thank you for that, because most of the time when you feel the onset of pain, that means that you're going too hard. Now we know 80% of people get low back problems. So what can we do to manage this comfort? So we have 2 different things we're going to look at. Hopefully, if you have low back pain, it's going to be acute, meaning it's short term and often gets better on its own with time. So we could use hot or cold packs as appropriate. You want to keep moving as much as possible, as long as there's not a whole lot of pain. So you're listening to your body, but if we keep moving, we could get blood flowing into those muscles, and that can help with the recovery process. Then you can use over-the-counter pain relievers such as ibuprofen or aspirin or acetaminophen. Check with your doctor before you take these, especially if you've never taken them before. Now, if you would fall into chronic or long-term, then we're going to be looking at some of the same types of things, the hot or cold packs as appropriate. Regular physical activity, again, just making sure that you're not doing any movements that make it worse. So really take extra precaution if you have a chronic back pain when you're doing physical activity. Do your best to maintain a healthy lifestyle. So good nutrition and sleep, tobacco cessation, and relaxing, not being stressed is going to help with that long-term back pain. And then again, consulting with your doctor about any over-the-counter or prescribed medications that could help. We talked a lot about flexibility before, and so I'm going to go ahead and share 3 stretches that you can do that, although they don't directly stretch muscles right in our low back, they're going to be stretching muscles that do affect the low back. So the first is a hamstring stretch. So if you're not standing up, go ahead and stand up and do this one. You're going to place one leg in front of you, keeping your heel on the ground and your knee straight. If you need something to balance on, stand by a chair and you can hold on to that. Keeping your back straight, place your hands on your thighs or hips for support and lean forward. Repeat this then on the opposite side. I'd recommend holding it for probably I like to go about 20 to 30 seconds. And then when you're doing these stretches too, if you feel discomfort or pain, you should still want to try to complete the stretch, but maybe just ease up on it. So again, just listening to your body. If it really feels like there's a lot of pain or numbness or tingling, then I would not recommend to work through that. So that's our hamstring stretch. You do that on each side, about 20 to 30 seconds. Our next stretch is a back bend. So with this, you're going to place your hands on your hips and lean backwards slowly in a very controlled manner. You'll pause back there, go for probably about 3 to 5 seconds, and then you would repeat that. And you can work that one in for that with that 3 to 5 second pause for about 6 to 10 repetitions. If you experience discomfort, perform it more gently, or any discontinue if there's numbness, tingling, or any increased soreness with it. And then our third is a quadricep stretch. So you're going to need to balance on this one, standing behind a chair with your feet shoulder width apart and your knees straight but not locked. Hold on to the chair for balance with one hand, and then you're going to grab the back leg and bring your foot up towards your body. Do your best to keep your knee pointed to the floor, and you're going to just gently pull until you feel a mild pulling sensation in your thigh. So in the front of your leg, we could go ahead and hold that for about 20 to 30 seconds on each side, and then we would switch. If you have a hard time with your range of motion to be able to grab your ankle, like we see here in the picture, you can loop a resistance band, a belt, or a towel around your foot and hold both ends in that way. So we would do that once on each side for 20 to 30 seconds each. And that would wrap up our 3 recommended stretches as a good starting point. A couple of red flags. While low back pain will often improve on its own, there's some situations where it's important to seek care from a doctor, as things may be more serious and require treatment. So if you have any of these things, I would recommend consulting with your doctor. And now starting to think about what you will be able to do next. So we talked about a couple of things already to get you thinking about it. You can look into an ergonomic assessment or job site work analysis, try one of the recommended stretches or try all 3 of them, explore some different stretches as well and make it a part of your regular routine. Break up prolonged periods of sitting or inactivity. So we have a great resource to do that with our CubeFit energy breaks that we're hosting through Zoom. We have 4 of them a day, 8:30, 10:30, 2:30, and 4:30. And they're 10 minutes, low intensity, and just good to break up 2 or 3 hours of sitting in front of the computer. If you're interested in that, you could visit our website, hfitdublin.com/CubeFit. And then you're just adding in a few minutes of movement and aiming to make it a daily habit. So hopefully these give you some ideas and you just start to think about what else is applicable to you in your life. And thank you everybody for joining me. I appreciate you watching the presentation, and you can reach out to me if you have any questions. Thank you.